Good evening. Welcome to another edition of Sound Health on Lagos Television. I am Ola Sumbo Mudupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. Today we are asking questions about the status of Nigeria's healthcare. Is Nigeria's healthcare facing a policy or finance problem? How do we start ensuring we translate our policies and finance into excellent care? Stay tuned, the conversation begins after this break. The program is still Sound Health on Lagos Television. Join us via Zoom this evening to take a look at Nigeria's healthcare policy and finance is Safiya Shuaibu Isa. She is the Director of Advocacy and Partnerships at Nigeria Health Watch, and she is going to tell us what we need to start doing to change the narrative about policy and financing in Nigeria's healthcare system. Good evening, Safiya Shuaibu Isa, and thanks for joining us.
Good evening, Olasumbo. Thank you for having me.
All right. It's long overdue. We've been discussing about universal health coverage for over some decades now. In less than 4 years, the deadline is about to reach our doorstep. Tell us, if you're to assess our efforts so far in healthcare generally, how has it been?
Thanks, Olasumbo. This, of course, pertinent and timely question. More needs to be done. Yeah. Short answer. But I would also say that, there are steps that have been taken, especially in recent times, to show that, there is this level of commitment from government, and we're really working to see how we can currently strengthen the existing policies and guidelines and frameworks that exist to make sure that we get to achieving universal healthcare coverage by 2030. What we need is acceleration, but I think not just acceleration, but acceleration in the right manner, making sure that everybody is pulling in the same direction so that, everything is just pushing and getting us closer. Primary healthcare is definitely the bedrock towards getting us to achieving universal healthcare coverage. It is supposed to serve, the purpose of preventive, curative services that will improve population health outcomes. This is where you're supposed to access your routine immunization for your children under 5, antenatal care services, even screening and diagnosis of non-communicable diseases. So it's everyone can be covered across the life cycle, from pregnancy to even elders can access very quality services at the PHC that would help us improve our population outcomes. But we have, I think, historically suffered an underinvestment in primary healthcare. And, it's, in this regard to see how we can strengthen current existing investments that have been made to see that we revitalize our PHCs, improve functionality, governance, coordination, that, we really reached out to the Lagos State Primary Healthcare Board and, tried to understand what we can do as advocates that are interested in seeing this arm, move from where it currently is to where it can be. And we sort of agreed that, look, there needs to be a leadership dialogue, because it is not just the sole responsibility of this current agency to ensure the delivery of this improved primary healthcare system. It is a whole of society and government approach. Even the citizens are involved and included. And, so this leadership dialogue, I want to say it's an important lever, and conversations such as this and engagements such as this are really supposed to strengthen that foundation that would help us to push together so that we can actually see it translating and getting us closer to achieving universal healthcare coverage. I want to pause here to be sure that I am, responding to what you expect from me in this regard.
All right, then. Thank you, Sophia. So we often hear about brilliant policies, implementation, right from the 1960s now to in the late 20s, 2026. Is it just about making policies? And how do we move from the roundtable discussions, policy advocacy? Because I'm glad you mentioned that you've made some steps towards achieving or changing the narrative.
Yes. All right. So, of course, policy without implementation is futile, and even more futile is not having an accountability framework or the inclusion of citizens' voices who are supposed to be beneficiaries of this health system, because they are the ones that will tell you if really the policies that you've put in place are working. And implementation does not need to be in any room, so to say. It is supposed to be out there on the field for everybody to see that it is being done. So, like you mentioned, we have beautiful policies on paper, theory, and we have sound technocrats with very good intentions. But for some reason, there's always a disconnect between implementation. A number of factors have been blamed for that. But I think more than anything else, what we and everyone else that is, concerned about this space wants to see is a move from the rhetoric, the theory, to actual implementation. Now that we understand what all these problems are, we have kept on rehearsing and speaking about them. How do we get from this point to the next point? And essentially, that was what that dialogue was about. We had representation from the 57 LGAs and LCDAs in Lagos, a very critical stakeholder in ensuring functionality and governance of primary healthcare systems. Because in our constitution, the management and operations of the primary healthcare system rests under the local government authority. But the Lagos State Primary Healthcare Board, in this case, has the oversight of ensuring the technical soundness and delivery of, the health workforce, services, quality, making sure that, this infrastructure that is in place is actually serving the needs of the people and maintaining quality standards. We have our permanent secretaries and the health districts. All these levels of governance have been put in place to actually ensure the effective governance and even rollout of services for primary healthcare. But one thing was clear: there was no communication, or rather it was really poor in terms of what it can serve to achieve. But even at the heart of that low communication was the fact that there was a misunderstanding about who is responsible for what. Financing is important, but if finances are deployed without a sound implementation plan, it leads to wastage, and then we cannot see functionality of PHCs. Beautiful buildings without health workforce to man and deliver the care that is required is also another gap. So maybe a PHC is existing and it's there, but there are no staff, and so it is not delivering on what it is supposed to. So it just means that all these systems or these structures need to work together as a unit, and that is one of the things that policy dialogue helped us to establish. Clear roles for our local government chairpersons, the clear role of our state primary healthcare board, the clear role of our health districts, and how they can complement each other to make sure there is improved service delivery for the people. And then the people also, the accountability that they're supposed to be responsible for, and how they can make sure their voices are mainstreamed in the delivery of care that is context specific and meets their aspirations. It was well attended. We even had representation from the Lagos State Health Management Authority, which is responsible for ensuring the delivery of health insurance, a key, service delivery that will make sure that people are not, how will I put it, impoverished by paying out of pocket for care at the hospitals. The health insurance scheme is a very important pillar in advancing us closer towards universal healthcare coverage, because we know that high out-of-pocket expenditure is actually one of the pain points of the people. It's one of the reasons why citizens lose trust in the health facility if they have to keep paying for services at very exorbitant costs. But the framework exists, that health insurance enrollment can reduce out of pocket expenditure. And if the awareness is there and more people are enrolled, more people are benefiting from it, it means that trust is being rebuilt, services are better rendered and delivered, commodities are available, health workers are better motivated to actually serve the community. So these are, some of the levers and the coordinating bottlenecks that need to be strengthened for us to actually advance closer towards universal healthcare coverage.
All right. I'm sure so many highlights were drawn from that roundtable, high-level roundtable discussions. What are the key action plans for total reform for you at that dialogue?
Wow. So many beautiful recommendations. What I'll say, well, I'll start by saying clearly that what we saw in that room was the commitment and willingness of the key stakeholders to actually collaborate. When the local government chairpersons expressed their concerns that they are not being informed about these PHCs that are supposed to be under their jurisdiction, they're not informed about the state of the PHCs, they are not told what the people are saying. And in fact, the oversight, has just been sort of like haphazard. And what essentially they were saying in that room is that we want to be carried along. If this is my responsibility, then tell me what is happening in my PHC so that I can do the needful. It's not just about coming to me and asking me to allocate more money. If I allocate more money, how are you being responsible or accountable for the funds that I have shared? Immediately they identified the gap that there needs to be a health advisory committee, which comprises of the local government representative, the representative from the state primary healthcare board, even medical officers of health, and representation from the health district. Now, this PHC advisory committees will now be responsible for mainstreaming and ensuring that the funds disbursed either through the basic healthcare provision fund or direct funding from the government is actually channeled to ensure that there are more health workers available at the primary healthcare centers. Commodities, drugs are available. When citizens that are enrolled on health insurance come for services, they are able to access their services without any pain or discomfort. The basic healthcare provision funding that is coming to that facility is actually being utilized for what it's there for. And what it is there for is for administrative purposes, making sure operations of the PHC are running smoothly, buying and restocking commodities, and making sure that the vulnerable members of that community are accessing care free of charge, because there is a provision for this set of people to be able to access care, because they have been profiled and they cannot afford to pay. So they are supposed to access services under the basic healthcare provision fund free of charge. So this PHC advisory committee, once it's institutionalized, will make sure that these services and these functionalities happen, and the people that need to be informed so that they can fix what is wrong are kept informed. So that was one of the major key takeaways from there. Another major key takeaway was for us to make sure that we revitalize and revamp our ward health committees. These are the key group of persons that can make sure that everyday Nigerians like you and I, when we have complaints or concerns with the kind of services that we're receiving, where we have a place, first stop, that we can go and communicate. Of course, we might not have access to the local government chairman, but we can access the World Health Committee to express our concerns, to say, look, this health worker attitude maybe in this PHC is not satisfactory. I was not happy with how my wife was treated. We went there and there was no immunization going on, and we were told to bring our children for routine immunization. So this kind of concerns, or maybe the toilets are not functional and is one of the reasons why our women and children don't feel comfortable coming to the PHC. So this kind of concerns, having a place or someone that we as citizens can share is why we need our ward health committees to be revamped and be brought back. So that's another key recommendation. Again, We heard, the LCDA and the LGA chairperson saying that, look, if they are informed about the accurate needs in terms of manpower, which is another gap, that's the health workforce, some of them are willing to actually recruit and staff the primary healthcare centers with the doctors, with the midwives that are required to make sure that services and quality of care are available at the primary healthcare centers. So in terms of, improving service delivery, improving standards, and making sure functionality and operation standards of practice are maintained, we had very important key takeaways. In fact, it was such a good meeting that immediately they were like, look, we would have to work towards a retreat that will have all of us in the room so that we'll get even to the nitty gritty, those other aspects that we could not expound on during that leadership dialogue, so that, if it's a matter of 2-3 days, let us sit down, talk honestly to ourselves, all of us, from the State Ministry of Health, local government authority, the Primary Healthcare Board, LASHMA, health district authorities, all the key stakeholders involved in improving and ensuring delivery of quality healthcare in Lagos State, planned that they would have that retreat so that even more concrete timelines and commitments and action points can be elicited. But just to say that, we as health advocates, we are already tracking these commitments and following up with the Lagos State Primary Healthcare Board, through the Lagos Primary Healthcare Board, to make sure that, number one, that Primary Healthcare Advisory Committee takes off. They start having those quarterly engagements, and making sure that the inclusion of citizens' voices through our Ward Health Committee is institutionalized, so that there is feedback and the people feel heard and trust is being rebuilt back in the health system and the primary healthcare, essentially.
Okay,
Let me pause
I'm
here.
glad. I'm glad trust is one of the key highlight for from the dialogue, and I'm also happy that accountability, when all these key players are accountable to the people, so the people they serve, trust is built over the night or over some period of time. Talking about accountability, I'm sure the basic healthcare fund was also in view at the health policy dialogue. How do we start ensuring that these funds are implemented for the purpose for which they were actually allocated? How do we also ensure that the people that are going to comprise of, they are going to be a part of the committee or the wards, would actually hold this, not just the primary healthcare board members accountable, but as well as other key players like the healthcare workers, the community healthcare workers, doctors, as well as the primary local government chairman?
Okay, thanks, Sumbo. I wish I had a direct answer that is going to give you clarity on this, but just to say that this is a space that we're closely watching, and honestly, we need to get it right. Currently, the Basic Healthcare Provision Fund is being released directly to the primary healthcare facilities, and different states have who they have assigned as signatory to that
To the
account.
account.
So it's like a direct facility fund. That's what, that's under the operational term for it. So it goes directly, and as I mentioned earlier, it's supposed to ensure functionality of the PHC in terms of ensuring commodities are available, administrative funds like payment of cleaners, ensuring water supply, security, and those kind of, administrative and operations services are available at the PHC. Different states have who signs those funds to access them from the accounts when they are made available from the state, from the what you call a federating account directly. What needs to happen is that there needs to be another level of maybe accountability and an observer committee, so to say, to be sure that, okay, the signatories, if it is the medical officer of health or the ward health committee or the local government chairman or the facility in charge that are responsible for signing for the release of these funds are actually delivering the services that these funds are meant for. And when I say an observer committee, is maybe give space for those listed individuals to allow maybe a civil society organization, for instance, to be the impartial partner here.
Do you think
or
when we
observer.
have, Safiya, do you think when we have some sort of private influence, the private sector influence, we'll get better results?
I mean, I'm all for all hands on deck. Right now, where we are in our health system, anybody that can bring possible, way forward and efficiencies to improve the system is welcome. Private sector has shown that, they have the efficiency and they run very effective, businesses and models. So if there is something that can come in and help the government facility in this case, it's highly welcome. A civil society can be a private body. It is not, they're independent. They're there for the good of the people. They're not supposed to be paid by the government. They're not supposed to be influenced by anybody. They're actually supposed to be the voice of the people. I'm using the word supposed to be because we know sometimes that the ideal is not always the case. But right now, civil society organizations serve as accountability mechanisms. So if they are given a seat at the table when decisions concerning basic healthcare fund are made, it is an important step. Even at the federal level, when ministerial oversight committees happen, civil society, the media, like what you're doing now, should be given a seat at the table to listen, to observe, so that they can now inform people or also be able to contribute and say, okay, look, we have observed that there are some discrepancies here and there, or if we do this and this, it will strengthen operations and make sure that there are no wastages or leakages. So that is the role of, us as advocates, civil society, and the media, to make sure that the voices of the people, and we're also serving as, checks and balances to make sure that there are no excesses. That's one way that we can make sure that these funds meet what they're supposed to do for the people. We also permit me to say that we also need transparency and access. So it's one thing for us to keep agitating as civil society and media, but if the government or responsible parties are not giving us that access and the information, it just makes us, appear to be speaking abstract without context. So enabling environment for us to be actually to deliver on our expected roles and duties.
All right, in 30 seconds now, your final words. What would you like to see going forward?
I want to see, first up, these commitments that we have, collaborated on take roots. For instance, the institutionalization of those quarterly meetings and the institutionalization of the primary healthcare advisory committees, revamping and revitalization of our ward health committees, and then the inclusion of citizens' voices in the delivery of primary healthcare services in Lagos State. These are the things that we really hope to see in this coming year, 2026.
All right, accountability, inclusion of citizen voices in order to change the narrative in the healthcare sector. We need to start owning our healthcare systems. Safiya Shuaibu Isa, Director of Advocacy and Partnership at Nigerian Health Watch. Thank you so much for your time and expertise on sound health.
Thank you. Thank you for having me.
You're welcome. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. Quality care isn't just an act, it's a ritual, it's a habit. If the public needs to get excellence from whatever healthcare service they can access, then the time is now to start changing the narrative. We need to start ensuring accountability. We need to start ensuring excellence, whether at the tertiary, or at the secondary or primary healthcare level. Accessing quality healthcare isn't just a responsibility, it is a right. This is why we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 00358266603 or follow us on social media at Lagos Television, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.